but yeah. Thank you all. I'm really excited to be here. Thanks, Wendy. I think because of the way the pandemic has been forcing us to do things, the pros and cons, right? I'm at my home, I'm not in my suit, I'm in casual clothes, so which is a good thing. But I'm sure you will hear noises in the background. You can hear my dog, you can hear my kids sometimes at this time of the day. So pardon me if you do any, if I do any of that, hear the interruptions. So I think it's a beautiful Wednesday. Weather is looking great outside. I'm really glad to have you all join this talk or a medium where we share our information. I really do a lot of work on cancer care support high-risk population. And I think this is a topic that is very dear to me. And today I think we are going to talk about a little bit about anti-inflammatory lifestyle. And I picked the lifestyle topic because that would include a lot of things. But today we're going to focus more on the diet, the supplement part, the physical activity, stress management, and sleep hygiene. So those will be the main areas of focus. Of course, if I just go off tangentially into another topic, I'll bring myself back in. Okay, so I know I thought this would be an interactive session because it's a Zoom session. I think if you have any questions, even during the talk, don't wait for the end. Just post it in the chat section. I think I can see it too, right, Wendy? I can see the chat session, and
yes,
then I can answer it right away. Not a problem, because there's so many topics that we'll cover. It might become too much at the end, to cover all of that stuff. So before we go ahead, I would like all of you to take a few minutes. I know I see some of you outside, you're probably driving or in your car or something like that. If it's not favorable, that's all right. But just reflect for the past 24 hours, how our day today or 24-hour day has gone by, okay? And I want you to split it up briefly into 3 big areas. One being the stress levels in the last 24 hours, which you can probably measure in an indirect way, how much good sleep did you get last night? Say, you can say I slept for 6 hours, or you can say I slept for 10 hours, though I slept only for 5 hours out of the 10, something like that. Just make a note of that. The second topic would be how active were you in the last 24 hours? So say, I went for a walk for 15 minutes, or I was going up and down the stairs in my house and got about 3,000 steps. Anything that would count as physical activity, just jot it down. And the last thing would be a little bit more, sometimes we tend to forget what we ate in the last 24 hours. Just what your breakfast was, what your lunch was, what your dinner was, and especially if you have some cravings, like what did you snack in between? Did you have a piece of pie? Things like that. If you can recollect in the last 24 hours, so something that you can put it down. And I want you to do that only because at the end of the talk, I want to see you to have a rough guide to see where you are in terms of what has been suggested as a good quality lifestyle, and how close you are or how far away you are from that. Okay, just a couple of minutes, and I'm going to jot down my last 24 hours too. And I'm not going to ask you to read this journal, so you can be honest. While you're doing that, I'll try to see if I can share my screen and presentation. Okay, I'm glad it's working.
You and me both.
Technology sometimes baffles me.
Yeah.
Okay, so let me get started, and I'll just start off with a little bit of what I do at the Integrative Center. So we run the Center for Complementary and Integrative Health. We started it about a couple of years ago as a full independent office. Prior to that, we were part of a primary care office doing a 1 or 2 days service a week. Now we are all 5 days, and within the last 1 year, I think we've grown, so much that now I think we have about 8 to 9 locations where we offer our services, and each center is different. It's part of sometimes it's part of the oncology team, sometimes it's part of the pain institute, occasionally it is part of the rheumatology or autoimmune institute. So the different models out there, but that's what we do almost all of the greater Pittsburgh region. That's what I'll say. And integrative medicine, basically what we're doing here is it's pretty simple. It's traditional medicine plus over and beyond that, we do a lot of prevention and promotion of health, where we are doing more healing oriented medicine. We look at different things that challenge a person's health, different things, including all what we're talking about, the diet, activity, supplements, lifestyle issues. Of course, chronic disease management is part of that. But we look at a person in the midst of all these factors, and we are trying to see how we can, help them recover or heal better from within with the minimal use of interventions or medications or procedures. So that's what we do in integrative medicine. And we are combining both traditional medicine and complementary and alternative modalities. And that's where Wendy was hinting to. We do have a set of providers. We have, I think, more than 5 acupuncturists, massage therapists. We do have people who do Tai Chi classes or services. We have yoga trainers who do those sessions, Reiki specialists. We have a dietitian or a nutritionist where we send our patients for diet, support, and so on and so forth. So and our slew is it's increasing as we speak, and we have multiple locations. So and some of our services can be done on the video and telephone with this new change in environment. So probably sometimes if you're unable to travel, say you're from Erie or something like that, you can do a video visit, a video evaluation with myself, my dietitian, and figure out what tools you need, to improve your health. So that's how we work out of this center. We have initially we took off from a grant from the Suburban General Hospital and their foundation, and they continue to support us. And we are located in the Bellevue area of Pittsburgh region. And the different providers that work with us, some of them are employed, so the dietitian is employed, but the other providers are all contract based, so they work with us, and sometimes they do have other positions that they hold outside Allegheny Health Network, but we can rope them in whenever we need and whatever location. So we have a very good flexible team, and that's how we work together. And some of the procedures that we do together as part of the integrative medicine, we have all these modalities, and not all centers have all of them. So if you're looking for some Tai Chi, we have it in a couple of locations. So it's a little bit confusing, but our center has one common number. So if you call them and you ask for Tai Chi, they can direct you. These are the 2 locations where you can get these sessions and things like that. So it's streamlined that way. So today I think I wanted to split up the topic into two areas, in the sense that when we talk about cancer and high risk for cancer or post-cancer care, We're looking at what are we trying to improve here, you know. So somebody has some sort of cancer. I know it can be as varied, as simple, where we sometimes just get away with a simple minor procedure like a surgery. On the other hand, we do have to partake in chemotherapy, radiation, followed by surgery, and, you know, medications, things like that. So whatever the treatment plan is, we are talking about the care of the patient during these testing times. Number one, when they have been recently diagnosed with such a condition, and first of all, they're not sure what the treatment entails, they're still going through diagnostic testing. And two, when they are actually going through these treatments, for example, somebody is going through chemotherapy, somebody is taking up radiation, somebody is waiting to get the surgery done. So that's one phase, one set of patient population I work with. The second bigger group of population is people who have been completely in remission. Like, for example, they had a cancer recently or in the past, and they've had treatments done. They underwent surgery, chemotherapy, radiation, whatever it is. And right now their oncologist said, you're in complete remission. We'll see you once every year or once every 3 years, depending on what it is. But make sure you stay healthy, take care of your health, and come back and visit us just to make sure everything is in good shape. So we call this set of patients as post-cancer care or in remission surveillance treatments, right? And when we talk about the risk factors, what are we trying to change in both these groups, or what are we trying to improve? So when we talk about that, we're talking about one, why do people get cancer in the first place, right? What are the different reasons why somebody can have such a problem? Number one, the genetic, which is what we call as non-modifiable. We cannot change it. But then I'm going to change that statement at the end of my talk. But for now, we'll say it's something that you cannot modify because you got it from your parents or grandparents or whatever. You can't change your genes, and for some reason you have the predisposition to develop a cancer. The second one is what we're really interested in when we're talking about integrative medicine, which is the environmental role. How does a lifestyle influence this genetic predisposition? How can we change it? How can we change our activity, our diet, our nutrition to probably reduce this genetic risk and reduce the cause for the cancer, right? So that's number one. So when we're talking about integrative medicine and the tools that we have, we're trying to reduce the second area, which is the environmental risk. And similarly, in the post-cancer group, say right now they're cancer-free, you're not worried about cancer, they're doing completely well. So you might ask, hey, why do I have to follow all this? I'm done, my treatment is done, I can live my life the way I want to. But no, what we're talking about here is, again, the group who have had the complete treatment in remission of cancer, the risk factors for cardiovascular disease continue to be the predominant problem to cause mortality and morbidity, right? So even if somebody has cancer and they're in complete remission, what is the risk for them to have a well lifestyle or a diseased lifestyle? And that all depends on their risk for cardiovascular disease, because that continues to be the leading cause of death and morbidity. So when we talk about cardiovascular disease, we're talking about heart attacks, strokes, and the risk factors for those conditions, which you probably heard about multiple times, which could be untreated hypertension, high blood pressure, right? High cholesterol, diabetes, untreated diabetes, okay, obesity, overweight, smoking, alcohol, poor lifestyle choices. All of these increase your risk for cardiovascular disease. So when we talk about lifestyle changes, we are trying to address all these causes or the risks to reduce that cardiovascular outcomes or complications, right? So those are the two big groups that we're talking about today. And when we talk about what is the basic mechanism which underlies these two processes, the two things that I want you to remember: one, inflammation. Inflammation is what is the underlying factor in when you talk about, say, even a simple thing like a sinus infection, right? A bacterial infection. That's what happens in the body. the body mounts a response so that it can fight off this bug or bacteria or whatever that entered the body from outside. And sometimes what happens is this inflammation becomes over and beyond what is needed. It becomes excessive, and the body sometimes does not have control on how to limit it. And when it becomes over and beyond, it causes problems. And one of the causes is cancer. The second one we're talking about is autoimmune disease, right? All the rheumatological conditions, a lot of disease processes have this inflammation as the culprit. And the second thing I want you to take home today is neuroplasticity. It's a new term. Neuro is something to do with the brain cells or the neurons, which are cells of the brain or the nervous system. Plasticity is something that is flexible. And when they put these two words together, they meant that the neurological cells or the neurons have the tremendous potential to regenerate. And that was a newer concept. Before a few years before this theory was put in, we thought that once you lost something, you lost it forever. You cannot regrow it. But now with neuroplasticity, there has been a lot of potential data saying that, say for example, somebody has a brain tumor and a part of the brain has been removed. That means they've lost some of the cells of the brain or the central nervous system, right? We initially thought we cannot regenerate them, but there is a lot of data to say that we do. The body has tremendous potential to regenerate some of the functions or the areas that were removed. So that simply is what is neuroplasticity. And that is exactly what I hinted at when I said it's impossible to change your genetic risk, but there is a potential, huge potential here for neuroplasticity, where you can change some of the things that we thought we could not change. Okay? And I'll elaborate that more towards the end. So inflammation is this. There is the good inflammation, where the body is trying to fight off different things, be it infection, be it cancer, be it disease. And body has all these good policemen that come in and fight. And the opposite of it is called anti-inflammation, which is going to control this inflammation and keep it in check and make sure that it doesn't become over and beyond. And you see the balance. It's a pretty it's a pretty delicate balance out there. So anything excessive can cause problems. And when we talk about a lifestyle, we're talking about anti-inflammatory lifestyle, where we are trying to balance out this different inflammation and keep it under check. And different types of diseases that you can have when the inflammation goes out of hand, primarily cardiovascular disease, Alzheimer's dementia, neurological diseases, arthritis, autoimmune conditions, diabetes, of course, pulmonary lung conditions, COPD, cancers, right? It's a lot of diseases that inflammation can lead to. So let's talk a little bit about the tools that we have when we talk about changing our lifestyle to bring about this anti-inflammatory lifestyle. And the data that we get from is one of a huge study that was done in 2007, putting together all sorts of numbers and epidemiological data by the World Cancer Research Fund and the American Institute for Cancer Research. Both of them came out with these recommendations. And this is more for the cancer care group, okay? So here I'm going to probably go through some of the important areas, and please feel free to stop me if you have any questions at any point. Number one, we're talking about weight management, body fat, BMI numbers, where that's calculated based on somebody's height and weight. So what is recommended from this study? What should be the BMI? And that is what the numbers are being recommended as 21 to 23. And as lean as possible, because we're trying to preserve the muscle mass, reduce the fat content of the body. And there are tools to measure the ratio of fat and ratio of muscle. We probably will not be going into that part at this point, but maintaining a good body weight, So weight management is an important key, especially when somebody identifies that they're high risk for cancer, or they're going to cancer care, or they're trying to improve outcomes. You know, so this is one of the areas that we'll talk about. Physical activity, very important area. Both sets of patients: one, people who are going through cancer treatments, and two, people who are in remission. What's the role of physical activity, right? When we're talking about BMI, ideal weight management, preservation of the muscle mass, and maintaining the fat muscle ratios or distribution, activity is a crucial area. And of course, when I have patients come to me when they're actually going through treatments, it's a little challenging, because especially if somebody had, say, breast cancer and they had surgery and they have resulting lymphedema and things like that. So they're restricted in the amount of activity that they can do. We are not going to enforce strength training, weight training, things like that, until they recover and they're cleared by the surgeon and they start up with physical therapy programs, gradually increasing their activity. On the other hand, somebody could be physically fit, they're in remission, they're doing well, they can slowly start working up, ramping up on their physical activity. And usually the guidelines are a little challenging to stick to. Usually, and that's why I have had you put down your activity in the last 24 hours as a rough guideline. So basically, we always try to customize the activity plan with every patient. I guess there is no magic number that everybody has to be at. It depends on their goals. What is their weight? Are we trying to lose weight? Multiple other conditions, arthritis. Do they have other neurological conditions, and how much can they do? Balance issues, especially in cancer care. We have a lot of balance issues after some surgeries, where we recommend more slow, gradual movements like Tai Chi and yoga, compared to traditional physical therapy, going to the gym and working out sort of a activity plan. And it also depends on the age, their physical conditioning or deconditioned state, right? Somebody who hasn't worked out, say for 6 months, they were pretty sick. I can't have them start, jogging and walking and all that stuff pretty quickly. So we have to really work with a physical therapy program and figure out what plan works for them. So physical activity, important part of the schedule, right? When we're talking about diet, before I elaborate the elements of a complete wellness diet, I'll just put out some strong points they've come up with, which are the do's and the don'ts, the big do's and don'ts, okay? So limit consumption of energy dense foods. So for example, say you have a slice of pizza, or a slice of a traditional cake or a pie, right? It's rich in fat, rich in carbohydrate, rich in straight sugars. So even a small piece of it has a lot of calories, and it's called an energy dense food. On the same side, if you compare it with, say, an apple, right? Though the size and volume is similar, the calories that you get from them are lower. So it's a lower energy dense food. So that's what we meant by limit consumption of energy dense foods, and avoiding sugary foods. And I'm sure all of us have known or heard, sugar feeds cancer, cancer cells feed on sugar. We don't want straight sugars, right? So whenever you're talking about foods, we are trying to look at foods that are straight release sugars, quick release sugars, or what we call as the glycemic index. And then we're looking at sugars or foods that release the sugar very slowly. To give you an example, say, for example, you eat a piece of white bread, right? Pretty quick to release sugars. On the other hand, you have a bunch of raw carrots. You haven't cooked them or grated them or anything. You're just chewing on them like a bunny rabbit. So basically, that's slower release sugar. It takes a while to process, get down there, and release the sugars. Something similar, like if you have, say, you're comparing two sets of fruits. Say you're looking at something like pineapple, okay? Pineapple or melons, quick release sugars. On the other hand, you're looking at, say, a pear or some berries, sour berries, slow release sugars. So whenever you take any food group, you have foods that will release sugars quickly, foods that release them slowly. So you're making that distinction and you're picking the right choice. So that's about the sugars and energy dense foods, which also includes the carbohydrate, right? And these are the foods that promote weight gain. And this is another strong statement that came out of this World Cancer Research Fund recommendations. Eat mostly foods of plant origin. A lot of animal protein-based products can be triggers for inflammation in the body. And we know that inflammation is the underlying mechanism for most cancers and other diseases. We are trying to reduce that inflammation. So we are trying to reduce animal protein intake. And again, in animal protein, there are good forms, bad forms, how to make the right choices. But the recommendation is when you compare your protein over a 7-day period, say you measured out, say, 3 breakfast meals, 3 lunch meals, 3 dinner meals. What is your major protein intake? It has to be plant-based protein. So the plant-based protein should be the predominant form of protein intake. And limiting intake of red meat and avoiding processed meat. That's a pretty challenging area, especially when people are trying to lose weight, cut down on carbohydrate intake, especially if somebody has weight to lose, somebody has type 2 diabetes, right? But definitely limiting the intake of red meat or eliminating it completely and avoiding processed meat. So when we talk about animal protein, they've ranked the protein as, say, for example, eggs are better, followed by seafood is better, a lot of omega-3 fatty acids. Lean meat is better after that, right? So in animal protein, that's how they've ranked it. Alcohol, minimal or none intake. So can I have a glass of wine every week? Little difficult to say. I mean, if it is giving you a lot of meaning, lot of satisfaction to that week's schedule, yes, go ahead and enjoy the glass of wine, but limiting your alcoholic drinks as much as you can, right? Because alcohol, again, known trigger for inflammation. So here I come to, so I wanted to put out the main points before I come to the whole diet. I think Dr. Weil, who's my director for the Fellowship for Integrative Medicine, this is a modified Mediterranean diet, but has been shown to be really beneficial for any sort of inflammatory disease, especially cancer care. And this is what we are talking about, anti-inflammatory diet. Okay. Can you see it? Okay, I can send you an email with the printouts, and I'm sure if you Google this, you get a nice colored pyramid. You have no issues. I'm sure you'll be able to, pull it up from online sources as well. But as you see, the base, it's like a pyramid, and the base of the pyramid is what we should be eating the most. And the top of the pyramid is what we're going to eat minimally, maybe once a week or something like that. So that's how it is. The base of the pyramid is what you're eating at least 2 to 3 to 5 servings a day. The top of the pyramid, you're eating minimally, maybe once or twice a week. So that's how you climb up the pyramid. So when you're seeing at the base, you're seeing vegetables. And again, when I talked about sugary and non-sugary foods, vegetables also, you can split them up. So for example, potatoes, carrots, beets, all the tubers, the starchy vegetables are quicker release sugars compared to broccoli, Brussels sprouts, cabbage, cauliflower, greens, that sort of a thing. And the more you cook them, something like cooked carrots, cooking sometimes makes it more favorable to release the sugars better, right? So that's about the vegetables. The fruits, the same thing. We want to avoid high fructose rich fruits. We want to use more fruits colored, rich with antioxidants, lesser sugar releasing fruits, right? And when it comes to whole grains, which is the next pyramid section in the pyramid, you're talking about whole grains, where you actually see the grain before it is made into some processed product, and your carbohydrates involve more of these grains rather than finished products. So something like brown rice, something like quinoa, something like couscous. So you see the grain and you can experiment with those grains. Pastas cooked al dente, so it's more like a little bit firm, not mushy. Beans and legumes, which is again your carbohydrate plus your vegetable sources of protein, right? Beans and legumes give you a lot of protein. And then when you're talking about fats, I think I have a separate slide, but fats, again, healthy fats for cooking like olive oil. You don't want to use some forms of fat which are not the best. Of course, fats coming from natural, like nuts, good nuts are good, encouraged. And then when you're talking about seafood, fish, omega-3 fatty acids, which is also a good form of fat. So that's almost half of the pyramid, right? That's the majority of the diet choices that you're going to take. And when you move up, you have whole soy products. And here I'd like to answer the question. Most women with gynecological cancers are concerned about use of soy products. I think the data is pretty strong. If you eat it 2 to 3 times a week, good soy products, no problem. And the phytoestrogens in soy are actually beneficial. They are actually anti-cancer, and they reduce the risk and improve outcomes. So that's what it is. 2 to 3 times a week, not more than that. And of course, when somebody is going through chemotherapy, through certain medications, yes, we have to use caution. And of course, that is probably dependent on the oncologist and the team to make more, finer suggestions. And other forms of protein, eggs, you see that good healthy herbs and spices. For example, you must have heard about pepper, capsaicin, turmeric. Turmeric is a very good anti-inflammatory product, better eaten through diet. Of course, we have supplements for people who cannot tolerate it in diet or need higher doses, right? And turmeric is better absorbed when you take it with black pepper. So it increases the bioavailability, because turmeric is not, to get the good dose, say you have to eat 2 tablespoons of turmeric. But if you eat it with black pepper, probably you can get away with 1 tablespoon. So it increases the bioavailability. That's what we call. So absorption becomes better. And then good teas, green tea, oolong tea, white tea, again, a lot of antioxidants which reduce inflammation, right? And of course, supplements, I'll leave that probably for a detailed discussion, because it's difficult to generalize supplements, but definitely for oncology, we want to make sure you have good optimal levels of vitamin D3, right? We are all deficient, and it's a very beneficial vitamin. Definitely B complex or B group vitamins, depending on what the patient's diet is, what they're going through. Definitely omega-3 fatty acids, fish oils, especially if their diet is not adequate, right? So based on a person's diet is when we suggest supplements, right? We want to clean up the diet first and then add supplements. And this is what we do when I see patients in my office. The first thing I say is, let's clean up your diet. I'll have you journal out your food for a couple of weeks. I'll have you come back. I'll sit with you and give you suggestions on how to improve natural foods that have these elements. And at that point, if we feel that it's deficient or we cannot add, that's when I suggest supplements, right? So that's how it goes. And then alcohol is pretty minimal up at the top. And of course, healthy sweets like dark chocolate and minimal intake of desserts and sweets. That's what I'll leave it there, right? So that's about the pyramid for the diet. Of course, we can spend a lot of time on this pyramid, but I think I'll take questions, because I'm sure you've heard a lot of speakers speak about these areas. I don't want to, go over the same facts over and over again, right? So general tips for eating: aim for a variety. So make sure, say you had breakfast, lunch, you had this vegetables, make sure for dinner you include this. As much fresh food as possible. For some folks, like working population, like for me, it's pretty difficult to eat fresh all the time. So sometimes frozen vegetables, things that can be eaten quickly, like I sometimes throw a bag of apples, bag of pears in the refrigerator at work, and get away, without having to cook and prepare much or plan much. So you can cheat a little bit, I guess, but make sure you eat as much fresh food as possible. Minimize your consumption of processed food and fast food, right? If you're hungry and you don't have anything to eat, and I'm always leaning for the cookie or the pastry that is sitting in my kitchen, right? So you want to make sure you have availability of good options, abundance of vegetables and fruits. More whole grains. Avoid products with high fructose corn syrup. Unfortunately, pretty challenging. You got to spend a good bit of time reading the ingredients and the labels of most processed food. Make sure that you're avoiding this. And when you cook pasta, make sure you cook it in moderation, not too soft, right? More beans and legumes, and less forms of refined products. More vegetable protein, especially from beans, soybeans, soy products. Decrease consumption of animal protein. So when I talk about fat, you're talking about good forms of fat, where the ratios in the fat are what you're looking at, the mono to poly, and they're reducing the intake of saturated fat, right? Which is the butter and things like that. You still want to use that, but moderate in moderation. Extra virgin olive oils are good. Avoiding margarine, vegetable shortening, vegetable oils. Products with soybean oil, they're all under vegetable oils. And so that's a general idea of the fats. Of course, avocados have good fat, nuts, good source of fat, chia seeds, flax seeds. Some food products have good forms of omega-3s too, which you can use. So that's so far I have about the diet. I think I should stop all the time. So if I can take some questions, or do you want me to go into more depth about this? Do you want resources? I want some feedback. I know it's a small group. I think I can ask for a feedback.
Feel free to unmute and if you would like any, if you have any questions, or type in the chat room, everyone.
I have a comment.
Sure.
Actually, I was at your counterpart today at UPMC, and someone who's never been to a wellness integrative oncology department, highly recommend it. I had acupuncture today, which I get about every 2 weeks now. I figured out a routine that seems to work very well for me. And going to their department, which I'm sure yours is exactly the same or better, whatever, it doesn't matter. It has helped me tremendously. So that's really what I had to say.
I was so glad to hear, because I think that was not a major part of my talk today. But let me just elaborate on the role of acupuncture for a couple of minutes. So this is how it works. What we've done, I mean, we have a lot of evidence-based guidelines, right? We are trying to see where we can use acupuncture to help improve outcomes. And the number one area is when somebody is going through any sort of chemotherapy or side effects from chemotherapy. That's one big area which we have noticed good results, in the sense that it reduces the side effects, reduces incidence of the side effects. And if somebody already developed side effects and they come to us, the intensity, the frequency and severity do come down. So somebody, say for example, is going through chemotherapy and they have had extreme nausea, they're not able to eat, they're not able to, they come to us, we offer acupuncture once a week, and symptoms improve and they reduce the amount of medications that they take for nausea. Okay, And the second big area that works is arthralgias, fatigue that develop with chemotherapy. A lot of people have extreme fatigue, exhaustion, joint pains, muscle pains. Not everybody develops that, but if people do, it is actually recommended to start the acupuncture even before somebody has these side effects to reduce the severity. But unfortunately, not everybody is aware of these services. When they have these symptoms, instead of taking painkillers, stopping the chemotherapy, it is better they try out acupuncture, which works really well and keeps them functional despite having those symptoms. So those are the two big areas for people going through treatments. Now, post-treatment in remission, acupuncture works a lot on different areas. Again, it's a little difficult to elaborate on all the conditions, because if somebody has diabetes, they have peripheral neuropathy, it helps really well. Somebody has arthritis, joint pains, it can help. So yeah, so acupuncture, pretty good role. We do have a lot of patients. And I think a couple of our offices, like we partner with an organization called Glimmer of Hope. I'm not sure if anybody's heard about this, but the Glimmer of Hope is a not-for-profit organization. They raise funds and they collaborate with oncologists and teams, and they actually give out vouchers to their patients, especially breast cancer, and they can avail, like they get like a pass for 8 sessions of massages, 8 sessions of acupuncture, and they come with this pass and they use our services so that they don't have to pay for it. So if they go through that program, we see a lot of patients, they get these services and they benefit from them. And that is also, I think we have 3 locations for Glimmer of Hope patients. So I'm glad it's helping you.
Mm-hmm. Thank you.
There are some questions in the chat box now.
Yes, I'm just trying to open up the chat. So BMI, I have a question. How do you figure out what your BMI is? There is, unfortunately for nowadays, we don't have to memorize any formula. When I graduated from medical school, I had all these formulas on my fingertips. Now I don't, because every time I just Google it up and the calculator comes up, I plug in the height and the weight, and lo behold, you have the answer, right? So everybody can do this. There are free calculators all over. I mean, you can just plug in your height and weight, and then it gives you a number anywhere from 18, 19 up to 30, 35. So ideally, let me give you a little bit information about the BMI that we have here in North America, right? This is for this population, for this particular height. This is the weight that is recommended, and this weight has been shown to have good health outcomes. Anything more than that, we have noticed increased incidence of cardiovascular complications, right? So that's the basic gist. And it is recommended for the American Heart Association to have a BMI of less than 25. 25 to 30 is overweight, over than 30 is obese, right? Unfortunately, these numbers do not hold good for people like me from Asian descent or other cultures. It actually, for Asians, when we've gone back and compared the data, we are supposed to be 2 numbers lower to the North American numbers. So for example, if a good BMI for this population is 25, a good BMI for me is 23. So that means the weight limit that I can carry is much, much lower. So you also have to put that in perspective when you use these scales. So that's how you calculate your BMI, right? And are you familiar with functional medicine? Very much. Functional medicine, so this is what happened across the spectrum of changes, evolution of complementary medicine. That's what I'll say. Conventional medicine was going on. We were doing that traditional, hospital care, medications, treatment, procedures, and all that stuff. On the other hand, functional medicine, alternative medicine, complementary medicine, all of these are terms that have been, so many terms that have been come up. And functional medicine is very much similar to complementary medicine. They also use a lot of natural, healthy modalities, supplements, procedures to improve health outcomes. How do I put it? So integrative medicine is like a huge umbrella that has all of these elements that have been incorporated based on their evidence-based guidelines, and it includes a lot of things. Some of these modalities are piecemeal, like for example acupuncture just deals with acupuncture, but they do also work with healthy diet, supplements to an extent, right? So they are also complete health systems by their own, but not as complete as the traditional. Like for example, traditional Chinese medicine is a complete health system by itself. Of course, we are not currently using the full benefits of it. Same with Ayurveda, right? The health system is a complete health system. It has all elements of healthcare. Again, not all elements are in practice, especially in this part of the world. So functional medicine is such a component. I hope I didn't confuse you. What are the 9 locations? It's a little confusing. I don't want to give out all the 9 locations because not all 9 locations are open to everybody. So we have 3 locations as part of a pain grant where we just see pain patients, pain management patients. So we have one in the main location is suburban Bellevue. Second one is Wexford Health and Wellness Pavilion. It's in the building. The third one is at Allegheny, the new cancer center that recently opened up a couple of weeks ago. Allegheny Center, in the down North Shore area. And then we have, on the east side, we have one in Mauriceville. In the south, we have in McMurray. And we have a couple more coming up, probably closer to Jefferson Health Systems. So yeah, it's a little vague, but I would use the by the way, West Penn. West Penn is another center where you get all the services. So for practical purposes, I'll say suburban location, Wexford location, West Penn location, and AGH Cancer Center. 4 are sort of open for majority of patients. The rest are more like they serve subsets. Yes, Glimmer of Hope is only for breast cancer patients. Right. What is the best way to get dark chocolate without sugar? Aldi's has a bar that is 85% cocoa. They list the chocolate as cocoa processed with alkalis. That's safe. So here we are trying to get the best out of the best. That's all we are trying to, right? Unfortunately, you see, it becomes a tedious process, and actually we complicate our lifestyles. If I'm going to micromanage and make every product from scratch, right? Say for example, pizza. If you buy a pizza outside, oh my God, then I have to start it from scratch. Get your flour. Make sure that doesn't have all the refined products. You are probably changing the flour, maybe going to almond flour and things like that to reduce the amount of carbs. So there is a balance between ideal nutrition and how much you can balance it with your, say, your work life or your home situation or your health condition. So honestly, I buy all these dark chocolate. So if it's if it's a balance between things, yes, there is. I'm not perfect. I'm not ideal. I don't ever make everything from scratch, and I'm not the perfect role model that you should be following too. But again, it's always a balance of those priorities that you have to make to check for availability. West Penn Hospital, yes, they have them. What? Let me see what questions. Do they accept Medicare? Oh, yeah, good question. Because I thought that would be the first question. But so this is how it is. As far as insurance is covered, my visits are all covered, billable to the insurance. You don't have to pay. Nutrition, dietitian, for majority of the insurances, we are finding that they are covered. If we use proper codes, like for example, somebody has diabetes, then they are covered. Somebody is perfectly healthy and they have no medical conditions. It's a little difficult to get it covered by insurance, but most of the times it is. Now, the other services, like the acupuncture, massage therapy, rest of the services unfortunately are not covered by insurance directly. That's what I'll say. So there are some insurance that we are realizing that if I give you a bill, you go and submit it to your insurance, they might reimburse a portion of it. I haven't heard anybody does it 100%. A portion of it could be covered. So I guess it's a good chat to have with your provider to see how do you go about this process, what will they cover, how can we work with them to make this possible. So that's what I'll say. So some people take the receipts and submit it. Sometimes we give the notes to go with it. So it's different for each insurance. Peanut oil for cooking. Okay, very interesting because oh my God, we fight about this all the time. So I'll share a small story with you. Back home, back in India, northern part of India, peanut is a very important crop. Okay, predominant crop, predominant oil, and they use peanut oil for everything: cooking, deep frying, you name it, they use peanut oil. And unfortunately or unfortunately, there's no increased incidence of cardiovascular outcomes. We were medical professionals. When I say we, healthcare providers, we were a little bit against peanut oil, say being the predominant form of cooking oil. We were worried that it was not complete, it is not the best form of oil, if it was the only oil that somebody was using. But then this particular population was doing really good. So I guess good mix of oils, because not oils are complete. That's number one. And when we're looking at the ratio, say, it's a good idea to make a food journal and see how much oil or fats you're consuming in a day, and see what are the different forms of oil, and make sure that you have a good, well-balanced oil population. That's what I'll say, balancing it out. Saturated and unsaturated, both forms. How does a not-profit organization partner with you to provide service? Question. So glimmer of hope, that's one example I'll quote here. So the way glimmer of hopes, I think I'm not the best person to give you the overall idea, because I don't know what happens on the financial and administrative side of things, because I'm sure we'll have to pay the providers and the services, and of course the overhead cost. For example, if we are coming to your location and we are providing services in your office, or you are coming to our location and you are providing it under our roof. So I'm sure there is all that involved, which I don't think I'll be the best person to comment on. But we have partnered with other organizations. For example, because we are a growing organization, we do not have some services that we would love to have at most locations. And when we find a patient, say somebody who needs a service that we are not able to provide in a particular location, then we tie up with the community there, the local resources there, so that the patient can use those resources. So that's one way of doing it. For example, with Glimmer of Hope, I think they do a portion of the overhead cost. For example, when we set up a location in Wexford, I think they pay for a portion of the space. They provide vouchers for the patients, and then they send their patients. We provide the services. So some model like that. And again, I think every model is different. For example, in pain management, the insurance gave a grant, like the Gateway Foundation. They provided a grant for these patients. So technically, the patients don't pay, but we go to their location and do our services, and the insurance directly pays us. So I hope I'm not confusing you all, but I think every model is different. If you have something in mind, please reach out to my practice manager, Sandy. I'll probably email it out, and that way you can reach out to them, right? You didn't see olive oil? It was on my slides. Extra virgin olive oil, I guess. And so that's the gist about healthy diet. Oh, no, thank you yet. I still have a few areas of importance I wanted to share. I won't take more than an additional 15 minutes. Is that all right? Or are we up for time?
Yeah, no, we're good. We're fine with you. Go ahead.
Okay. So, I mean, we've done all this. I mean, I have no talk complete without focusing on stress management and relaxation. And whatever you do, how healthy you eat, if your mind upstairs is not in a state of balance, I think the majority of the benefit is not there. So today I'll share a couple of simple techniques with you. If anybody's already heard me talk or listen to any of my presentations, you will notice that I do a couple of practical things. So today I will again, let me see if I can share this. So when you're talking about stress, and this is again a topic on neuroplasticity, where we are trying to change our genes, our chromosomes, the ends of the chromosomes, which are called telomeres. When there is a lot of stress and inflammation, they tend to wear down and they don't function well. And when we handle our stress better, this reduces that damage and increases health outcomes, right? So that's basically the concept. And the mind-body connection, huge connection. You all must have experienced, you can have a wonderful meal on the table. Say you heard some sad news, or you're troubled about something, or you have a test coming up tomorrow. How much can you eat and how much can you enjoy that meal, right? So the huge mind-body connection, and that is what we are trying to help people develop a good eating routine. Intuitive eating, that's what we call being mindful at the table, being able to monitor what you eat and monitor the state in which your mind is when you're having your meal, so that improves or controls a lot of the factors that go into our eating patterns. Okay, so we'll do a small meditation technique, and it's all pretty simple, nothing major, no tools needed. Just sit back, relax, and I'll see if we can listen to this, and at the end we can share our experiences and a lot of benefits for meditation. So that's what we're doing, but let me see if I can play it. Okay, everybody can just close your eyes, sit back, relax. But if you're driving or doing something outside, please don't just listen and watch.
Dr. Karri, I don't hear anything. Are you seeing?
Okay, you're not able to hear anything.
No. So, this happened to me when I tried to play a video, and actually one of my students showed me that on where your sharing is, if you're sharing from like, if you go to your Google page to the it has an option to turn the audio on for the video. So I'm not sure if I have to do that.
Okay, so let me try this. So are you able to hear it now?
No, we're not able to see or hear anything.
Okay.
There's a setting to be able to.
Okay, so now I got it. Hang on, give me 1 second. New share. There we go. Now I get it.
There you go. Perfect.
You're able to hear now?
I can see it.
Okay. I think it's yet to start. No sound yet?
No sound, just picture.
Ah, okay. You are sharing the screen. It's very relaxing. The screen is very relaxing, at least.
Yes, it is.
So you know what? I'll just play it here on my phone. I'm sure you can access it and play it, but I want to be able to, you know, everybody to do it.
Many of us today live in a state of chronic stress.
Okay, so I'm just going to try to restart the video, the same spot, and then play the audio. Okay, so this is, can you hear this?
Yes. Yeah, that's good.
Okay, that's good. Okay, let's do both.
Heartfulness guided relaxation. Find a comfortable position. Close your eyes. Allow your breath to be normal and calm. Relax. Let's begin with the toes. Bring your attention to your toes and begin to feel your toes relaxing. Your toes now feel more relaxed than they have ever felt before. Now feel your feet and let them deeply relax. Feel your ankles. All tension is leaving your ankles. Relax. Breathe in and let go. And then move to your lower legs. Feel them relax now too. Breathe in gently and relax. Move to the upper legs. The upper legs feel totally relaxed. Now the whole legs feel relaxed. From the top of your legs to the tip of your toes, feeling relaxed. Breathe in and let go. Bring your attention to your buttocks and hips. Release any tension you may be holding there. Relax. Breathe in and let go. Move your attention to your abdomen. Feel your abdomen muscles begin to relax and let go. Breathe in and let go. Relax. Moving up into the chest. Breathe in and let go. The entire chest area is relaxing now. Bring your attention to your back, beginning with your lower back. Breathe calmly, slowly. Relax and let go of all tension in your lower back. Moving on to the upper back. Release any tension you hold there and just relax. Your back area is now completely relaxed. Then draw your attention to your fingertips. Relax your fingertips. Relax your hands. Your lower arms are relaxed. The upper arms are feeling deeply relaxed now.
Hello, Mom.
Breathe in and let go. And now, relax the shoulders. The shoulders are relaxing and melting away. Begin to relax the neck. Release any tightness in the neck muscles. Relax. Breathe calmly. Releasing all tension from your neck. Move your attention to your face. Relax. Your jaws begin to relax. The lips are relaxed. Eyes are closed very gently and very softly. Relax. Now move up into your mind. Feeling deeply relaxed inside. Breathing calmly. Allow your mind to relax. Now move your attention towards your heart. Relax into your heart. And now just remain there. Feeling deeply relaxed in your heart. Stay there for a while.
You can slowly open your eyes.